Okay, here's the book called Hormone Secrets, How to Feel Great and Age Well with BioIdenticals. It's written by this guy right here, Robert Yoho. And there's good things and bad things about this book. The reason why I read it, from start to finish, and the reason why I'm reviewing it is because a lot of viewers have asked me about these questions. What about bioidentical hormones? What about estrogen replacement for postmenopausal women? Is there really that much higher an incidence of breast cancer? What about testosterone replacement for men? What about thyroid hormone replacement for people who have normal labs in the middle range? And he goes into all that stuff. And to let you know, I don't have that much experience with, prescribing hormones and using hormones in older persons. Myself, I don't take hormones. But what do I actually think from what I do know about it and what I've read about it? I think that bioidentical hormones are being unfairly suppressed because they're not able to be patented, so the big drug companies don't want people to take them. I also think a lot of these old guys should be taking testosterone, and a lot of these old women too. I'll just tell you something that happened, this is many years ago now, about 10 years ago. I'm sitting in one of these cancer conferences, and they're talking about the patients severely debilitated and cachectic, okay? That the cancer's sort of eating them from the inside, and it's real sad and all that kind of stuff. And I said, and then the patient's losing weight, and they're all weak. I'm like, well, you know what? Why don't you give the guy testosterone? And everybody looked at me like I was inappropriate. How dare you say such a thing? Don't you know that nobody does that? And I said, look, I was in college. I hung around with a lot of football players. The football players in college, they were all taking anabolic steroids, and it helped them to gain, 50 to 75 pounds of muscle. After their fourth year, if they didn't get drafted to the pros, they go off the steroids and they would lose like 50 to 75 pounds. That's a lot of muscle. So why shouldn't you give it to these old people? And then they're going to say, well, it increases the risk of heart disease. It increases the risk of prostate cancer. And I'm like, a lot of these old people, they're half dead already. Why don't you give them a chance to come back to life? And I think they exaggerate the risk of heart disease and prostate cancer from testosterone. And like you'll say to yourself, well, how could I say that? Everybody knows. Do you really know that? Who gets prostate cancer? It's not the young guys with high testosterone. It's the old guys with low testosterone, okay? Same thing with breast cancer. Who's the main person who gets breast cancer? It's the old lady who's got low estrogen, not the young lady with high estrogen. Now, don't get me wrong. There's all kinds of things like opposed or unopposed estrogen, how many kids you have, do you nurse. I know there's all that. And I don't pretend that I'm an expert on these hormones. And they're more complex than you think to know how to prescribe them. There's all these different versions, the cream, the pellet, the etc., the injections. But what I am saying is, like, why do I like this guy? On the one hand, I kind of like this guy. And on the other hand, I kind of, on some things, think he's an idiot. And I'll just tell you where that's coming from. He himself was an emergency room doctor, and then he actually became a cosmetic surgeon. And he does have decades of experience treating people with these problems, so that's valuable. The main thing I like about him is I think he's honest. He's trying to help the patients. He's trying to answer these questions honestly. He's retired. He's not making any money from this. But and he actually, you could go to his YouTube channel. You don't have to buy the book. You go to his YouTube channel and listen to the video over there. So it's just his name, Robert Yoho. So I like the fact that he seems honest and he has a lot of experience and he seems like he's trying to tell the truth. I don't think he's just doing this for money because I don't see the money in this for him. But what do I not like about him? Like a typical conventional doctor, he doesn't know anything about nutrition. He says a lot of really stupid things like recommending paleo, keto, and all that kind of stuff. And you're like, whenever somebody recommends paleo, keto, they not only don't know nutrition, then you know that they don't know epidemiology, and you know that they don't really know pathophysiology either, okay? So that's a bad sign. On the other hand, he does do the best he can to read the studies on these hormones. And like I said, the bioidenticals are the same as the hormone that's in your own body. Therefore, they have far fewer side effects. They'll come from these like compounding pharmacies and whatnot. But the problem with these places is you don't know how long they're going to be in business. Big Pharma is trying to put all of them out of business. So I don't know how long they're going to last. Because Big Pharma, hates competition. And their competition, they provide a better product for a lower price. Big Pharma wants patented drugs that they can sell for a very high price. So again, Yoho says all these side effects that are claimed against these bioidenticals are totally exaggerated. But, let's see what else. So the book was interesting about talking about how to replace testosterone. He spoke highly of human growth hormone, of estrogen, progesterone. And then another thing I found real interesting was he said a lot of people on thyroid hormone, the endocrinologists are too wimpy. They just try to get their TSH and their hormone levels in the middle of the range. But he says you really would want your hormone levels higher. And again, I would worry about that. If you push your thyroid hormone too high, are you going to have trouble sleeping? Are you going to have worsening insomnia? Are you going to have increased risk of atrial fibrillation? And he says, despite the concerns about AFib, he said that hardly ever happens, and you could dial down the dose afterwards. I don't know. You can have a problem pretty fast with AFib. So I'm not going to claim that I know this stuff well enough because I don't. A person who's an endocrine, who's done an endocrine fellowship and works in this area all the time, or somebody in some other cosmetic-related field with a lot of experience in it, they might be quite good at it. All I'm going to say is I do think he has a point. I do think that Big Pharma doesn't want old people taking these hormones because then they feel so good they don't need all these other pills. And so I think they probably should be used a lot more. But I can't claim the expertise to know exactly how to do it because there's going to be pitfalls. There's all kinds of prescription issues. What form of the medicine do you take? Which one has the best risk-benefit ratio for you, the individual? But it's a good starting point to read what he has to say and to go from there. Because he does know a lot, and he is a pretty intelligent guy on these types of things, and he has a lot of cosmetic experience. So I'll just leave it at that. It was an interesting book. If you're interested in this subject, it'd be a good place to start, but you're going to want to read a lot more than just this if you decide to go down that path. So hope you found that helpful.